I'm Leonard. I'm student ID number 3345462. This is my fall 2019 semester. This is my AVMA test video for Veterinary Clinical Pathology 2, VTHT 2331-31421. Okay, so this is Rupert, and he's here today for a 1-year history of a skin infection. And so our doctor wants to go ahead and check a DTM on him. So I'm going to make sure I have my sterile hemostats, and what I'm going to do is I'm going to open him up. We make sure that we have our gloves on in case there's any sort of infectious or fungal bacteria disease going on. And I'm going to try and select an area that is relatively fresh or a new lesion, and I'm going to go ahead and pluck at the peripherals of that, and I'm going to have 10 to 20 hairs. So I'm going to look around, and everything looks kind of old, like it's been here for a while. So I'm going to go ahead and just select a portion of that, and I'm going to pull it out. There we go. I'm going to open up my medium, which is our DTM sample. And I'm going to go ahead and place them right on top, and I'm going to push them in well. However, I'm not going to bury them. I'm just going to make sure they're sitting nicely in there. That looks like it's about 20. So now I'm going to go ahead and loosely place my cap, and I'm going to properly label the DTM. We're going to make sure we check it at least once daily for any sort of abnormal changes, and we're going to come and look at it at the very end of the 21 days and see what we find. Okay, so today we were checking a fungal culture, and the reason that you want to check one is if your pet is having some hair loss, if they're having dry, scaly skin with some abscess-like lesions on that, you definitely want to check that for any sort of fungal, possibly ringworm or something like that. So we had our sample, and we had it sitting in a dark cabinet for 21 days, and there was no color change, there was no growth to it. So we're still going to go ahead and treat it as if it was positive. We're going to look at it under the microscope to see if we do come across any spores or anything. I'm going to grab some gloves. Right here. I'm just going to take a piece of our cytology tape. Jeez, I'll cut this out of the video. Trying to get it nice and smooth. Okay, there we go. Alright, now we're going to take 1 drop of our methylene blue, place it on our slide. Put our tape on top. There we go. And we're going to go ahead and read it on our microscope under the 100 power. Bring that into focus with my coarse focus. Alright, then once I'm there, I'm going to go ahead and use my fine focus to get it into view. And I'm going to move around. I'm going to be looking for corn cob shaped spores. I'm going to be looking for cigar shaped spores. And that's going to let me know if there's any sort of colony growing or any sort of fungal infection. But everything looks pretty negative in here, which is pretty consistent with what our DTM culture observation is showing us. Alright, so I'm going to go ahead and call this fungal DTM a negative result. So I'm here with one of my preceptors, Dr. Tracy Perdue, and we're going to be performing a necropsy on this cat. So we are making sure that we are donned in our proper PPE. So we have a surgical mask, some sort of cap, sterile gown, as well as sterile gloves. The reason we want to make sure that we stay sterile during this procedure, even though, or we stay protected during this procedure, is even though our patient is deceased, we want to make sure that we keep all of our samples as sterile as possible so that when we send them out to the lab, we have a nice uncontaminated sample. The PPE is also good that way in case the pet does have any sort of infectious disease. We're not going to be spreading that anymore as well. And so we don't really have much history on this cat. This cat was actually a feral cat that was at the pound, and it was euthanized earlier this morning, and so we're going to go ahead and perform our necropsy on it right now. And Dr. Perdue is going to start with her external exam.
Okay, so at first glance, we can see that the kitty does have some fleas here. Most of them appear to be dead, but not a surprise in a feral cat. We're going to look at the orifices too, make sure that we're not seeing any abnormal discharge from the mouth, the eyes, the rectum, and this cat actually is a male. We do also see a little bit of hemorrhage, so I don't know if there was maybe some sort of trauma or if they did maybe do some blood samples on the cat before it passed away. Not really sure, but that's something just to make note of. And then I'm just kind of feeling the belly a little bit, and I do feel like the intestines feel quite thickened, so it'll be kind of interesting to see what we find when we get inside there. So I'm just going to shave a little bit of the hair here just so it can make it easier for me to cut through the body wall. Alright, so we're going to cut through the body wall.
I've actually never seen it.
We don't want to puncture any of the internal organs here, so we're going to try to make the incision the length of the body so we can look into the chest cavity as well. And with kitty cats, you can cut easily through the ribs with these. Okay. So we can start with the abdomen. You can see here the liver. Grossly, it looks pretty normal. I'm not seeing any nodules. The color looks fairly normal. No plaques or anything like that on there. I think it's important a lot of times just to get samples of each major organ regardless, because you can't always see everything grossly. So we'll definitely get a sample of the liver. You can see the gallbladder there. That also looks fairly normal. So I'm just going to get a quick sample of just this middle liver lobe.
I'm going to make sure that I label this appropriately as the liver lobe. I'm also going to put the date and the time of today, as well as I'm going to label it as a feral cat, so that when we send it out, we have everything appropriately labeled.
And then we can go to the intestines here. They do feel kind of thickened. So we'll just kind of take these out. You can see the stomach here. It does feel like it's maybe full of some ingesta. I'm not seeing anything crazy abnormal here. That's the duodenum. Duodenum does have some sort of white focal lesions on there. So we'll get a sample of that as well.
We'll go ahead and make sure I label this as the date and time. It is 12:05 right now. We'll also label it as a stray feral cat.
And then I will just kind of cut into the small intestine and make sure I don't see anything abnormal in there, in the intestinal parasites. And we'll go back here, Carly, to the bladder. That grossly looks normal. You can see that there's a large amount of urine in there. Take a look at the colon there. It's full of stool. You can see the liver here looks pretty small. Again, that doesn't have any abnormal lesions there, but and then next I'm looking at the left kidney there. That looks pretty normal. We can come over here and try to find the right kidney, and that's kind of hidden down here and looks pretty normal. So overall, not seeing any abnormalities grossly, other than some external parasites. The heart looks pretty normal. The lungs maybe look a little bit congested, but that can be a normal post-mortem change. So overall, not seeing anything crazy abnormal, other than just some external parasites. But it's important to do some biopsies just to make sure that there's nothing abnormal there going on. So,
All right. So necropsies are good. That way, if the pet does have something abnormal going on with them, hopefully you can use that to figure out what was happening, especially if you have a pet that just kind of died all of a sudden. You want to figure out what happened, or if you know that they had a disease and you kind of want to see how it had been progressing, you can send a biopsy or a histopath out that way. We generally don't do them super frequently here at our hospital. However, if the owner requests, we can do a necropsy and we can send any samples out to the lab. Okay, so today I'm going to be performing a vaginal cytology. The first thing I'm going to do is you want to sterilize the area. So I have a Chlorhex and saline scrub over here. I'm going to do it 3 times each. And the reason that we're doing vaginal cytology is to figure out what stage of estrus she's in. So we're going to get our sample and then we'll look at it under the microscope and look at the different cells to determine where she is in her cycle. Okay, so that's all clean. Now we've got our sterile cotton tip applicators. I'm going to go ahead and put a little bit of saline on that to moisten it. All right, now I'm going to go ahead and insert into her vagina. I'm going to go ahead and pull down on it. Let's see. I'm going to insert at a 45-degree angle. And then I'm going to straighten it out and swab the wall. Spin it around a little bit. Good girl. There we go. And now I'm going to go ahead and take one of my slides. Take one of my slides and just roll it nice and evenly. And then we'll go ahead and get this stained out and check it out under the microscope. Okay, so my sample has completely dried, so I'm going to go ahead and stain it out. I'm going to do about 15 dips in the blue, 15 in the red, and then about 25 in the purple. So now I'm going to go ahead and gently rinse this off. I'm going to blot it to dry it with my bibulous paper. Make sure to place my tops back on here so they don't dry out.
It was Dugan, that's why I was like, I'm so confused. I was like, I don't remember this at all. Like,
all right, and now we're going to go ahead and look at our vaginal cytology under microscopic evaluation to try to determine what stage of estrus she's in. All right.
here we go. I'm gonna write it.
So sliding around on here. So I'm seeing rather large cells. It looks like they are, to me it looks like I would consider this an estrus, which means she's probably really far away from being ready to breed. She probably would not willingly accept a male at this point. So I'm seeing squamous epithelial cells. All right, and so yeah, I would consider this pet being an estrus, and that she's not a good candidate to breed right now. Okay, so the stages of estrus. The first stage is anestrus, and that is when the pet is not going to have any vaginal discharge. They're about the farthest point away from being ready to breed as possible. They're not going to seek out or accept any males at this point. And when you're looking at this, these cells on cytology, you're going to be seeing squamous epithelial cells. The next stage is proestrus, and they're going to have a swollen vulva with a reddish discharge. And they're going to attract males, however, they're not going to accept them, and you're going to be seeing erythrocytes when you're looking at that under the microscope. The next stage is estrus, and they're going to have a strong pink discharge that's slowly going to turn white over the course of the cycle, and they are going to attract and readily accept males at this point. And then next is the medextrus, and they're going to have the vulvar swelling and some discharge. but they're gonna have less attraction and less accepting to males. And they're gonna have non-cortified squamous epithelial cells. Okay, so today I'm going to demonstrate how to do a cross-match agglutination. So the first thing you're going to do is you're going to get your samples from your donor and your recipient, and you're going to put them in the EDTA tubes, and then you're also going to put them in serum separators, and you're going to let the serum separator clot, and then you're going to go ahead and spin it down in your centrifuge. Your EDTA tube does not have to clot, you're just going to go ahead and spin that. I did already spin everything, and I poured my serum out of my serum separator directly into my red top tube. And also for your EDTA tubes, once you do centrifuge it down, you want to make sure you carefully remove it with hemostats. That way you don't invert your sample. Be really careful with that. And the first step that I'm going to do is I'm going to go ahead and take my donor sample. And I'm going to go ahead and discard the very top layer. So we're going to discant that. I'm going to be doing this for the recipient and the donor. Alright, that looks like that's all of that. Alright, so once that's all out, then you're going to go ahead, this is our donor sample, I'm going to go ahead and take 2 drops of the donor sample and put it into a clean, fresh container. I'm going to go 1, 2. Alright. And so they are both my donor samples. And then I'm going to go ahead and just fill the rest of the way with some saline I already have pulled up. There we go. I'm going to go ahead and place my top on. We're going to centrifuge this for 1 minute at 3,400 RPM. Before I do that, I'm going to go ahead and do the recipient one as well. That way I can centrifuge them together. That way they'll balance each other out. So here we go. We have our recipient sample. Let me grab another pipette real quick. There we go. Decant this top sample. There we go. And then we're going to take another fresh one, and we are going to get 2 drops of the clotted blood. Real quick. And put it into. Let me get the top off of there real quick. There we go. 1, 2, and this is my recipient tube, and I'm also going to fill it the rest of the way with the saline. There we go. We're going to put our top on. We're going to go ahead and invert them really well, and then we're going to go ahead head out to our centrifuge and spin them down for 1 minute at 3,400 RPMs. You're going to make sure you put them directly across from each other to balance them. Make sure everything is set properly, and it's set for 10 minutes, or I'm sorry, for 1 minute, and we'll come back and check it as soon as it's ready. Okay, so our samples just finished centrifuging, so we're going to go ahead and remove the saline supernatant from each of our samples. And I'm going to go ahead and put on a fresh tip, and I'm going to do the same thing. I'm going to remove that saline supernatant on our recipient sample. Alright, there we go. So now that I went ahead and discarded that supernatant, I'm going to go ahead and refill it with some more saline. And the reason we're going to be doing this is because we're going to be washing the erythrocytes. I'll try that as clean as possible. Our donor. There we go. And we'll go back out to the centrifuge and spin these down for another minute at 3,400 RPM. Okay, then one more time for each. Okay, so we just did our final wash for our donor and our recipient samples. I did go ahead and just discard this the saline supernatant, and I went ahead and removed 0.02 mLs of the packed the washed red blood cells from each of the samples. I have them labeled. This is my recipient sample and my donor sample, 0.02. And so what I'm going to do now is I'm going to make a 2% erythrocyte suspension. And I'm going to do that by, I have a fresh tube. This is our final wash for the recipient. And I'm going to put 0.9 mLs of saline in here, as well as that 0.02 mLs of our recipient's washed red blood cells. At the top of there, I'll go ahead and invert that a few times. All right, there we go. There's our recipient sample. And I'm going to do the same thing for my donor sample. Get that all in there. All right, and here is our nice end mix sample. So now I'm going to go ahead and do our major cross match. So I went ahead and labeled my tube major cross match. So what I'm going to do is I'm going to take 2 drops of my recipient serum and place it into my tube. Get that off. Got 1, 2. There we go. And I'm going to take 2 drops of that erythrocyte suspension that we just made. I'm going to place that in there as well. 1, 2. Here. I'm going to go ahead and gently invert that. All right, and that is our major cross match. And then I'm going to do our minor cross match. I have a separately labeled tube for that. So I'm going to go ahead and switch out. All right, and this is going to be my donor serum this time. I'm going to take 2 drops of that. Oh, I missed this one. 1, 2. And then 2 drops of my recipient's cell suspension that we just made. One, 2. All right. Put our cap back on there and gently invert that a couple times. All right, now we're ready for our next step. So to check for autoagglutination, the first thing you're going to do is you're going to make your controls. So what I'm going to go ahead and do is I'm going to take 2 drops of our donor serum, and I'm going to put it into a separate donor control tube. So we'll pull that up. 1, 2. And I'm also going to add to that 2 drops of that erythrocyte sample. Let me grab a tip for this really quickly. All right. I'm going to reach down in there and grab 2 drops of that and add that to my control sample. 1, 2. Perfect. Alright, and we're going to go ahead and invert that a couple times. And so this is going to be our donor control. And I'm going to do the same thing for my recipient. So I'm going to go ahead. I've got a recipient control right here. I'm going to take 2 drops of my recipient serum. One, 2. And 2 drops of my recipient's sample that we made. 1, 2. There we go. All right, I'm put my cap on. I'm going to go ahead and invert that while we get ready for our next step. Okay, so we had let our donor and recipient controls, as well as our major and our minor cross matches, we let them sit at room temperature for 30 minutes, and then we spun them for 1 minute at 3,400 RPM. And so now that we did that, we're gonna go ahead and we're gonna closely examine all of our samples. We're gonna be looking for any signs of agglutination. So we're gonna be looking for signs of clumping. And it does not appear that I see anything in my samples. And so my next step is going to be to go ahead and look at them under the microscope just to be able to determine if these two pets are a good match for cross-matching. Okay, so now I'm going to go ahead and check under the microscope to look for any signs of agglutination. So first I'm going to take my major cross-match, and I'm going to put 1 drop on a slide. There we go. I'm going to cover it with a single cover slip.
Well, I do that too, but you just
Go.
gotta roll out of bed.
And look under the 10 power, a nice low power.
In your finger.
Get it into focus here. I'm going to use my coarse focus until I get it in view. Alright, now I'll use my fine focus to focus in.
That's true. You can't have all beautiful.
Alright. So I'm going to go up and down my fields just to make sure I can kind of check all around.
It just depends. I feel like whenever I get a picture taken, I'm kind of like, I don't like it. And they're like, don't be
And so far, I am not seeing any signs of agglutination. Everything is moving around really freely, which is a good sign for this recipient. Okay, so since that one looks good, I'm just going to double check with my minor cross match. I'm going to go ahead and put a new tip on here. And take 1 drop of my minor cross match. On a new slide. There you go. With a cover slip as well. Alright, I'm going to double check this one as well. Get everything in focus.
It's not all our fault.
There we go. Alright, and it looks like everything is floating around pretty freely in here as well. I don't see any clumping, I don't see any rouleau. So I think that these two, the donor and the recipient, would be a great match.